Good morning, everybody. I hope you're doing well. I'm hoping my voice holds up through this. I'm doing much better. Still have a little bit of the bug though. I have a couple of things that I want to talk about this morning. The first thing is, if you're having a hard time with STEM charting and your grade is poor, like D's or F's, I am giving you an opportunity to contact me to figure out a way to help bring your grade up. We can do a project, but you and I will have to have a conversation on that. Not talking to ladies that are sitting in front of me necessarily. Remember, I'm recording this for everybody in our class, right? That aren't with us. So I just want people to understand that I know that sometimes your internet is not connecting right. The SIM charts are glitching and acting up. I know that there's a lot that can go into this. So I'm offering you an opportunity to get with me. I'm not hunting you down. If you want a project to help boost your grade, please contact me and we'll get together and figure out a project. Now, that doesn't mean contact me on day 19 to get a project in by the 20th for day 20. Go ahead and contact me now if your grade is not where it needs to be. Okay. Second thing is, today we're going to be doing an Ncct packet, not a whole Ncct packet. I'm just going to pull some very important key terms, and we're going to talk a little bit about those, because today for lab you have an Ncct. It's labeled exam, not necessarily an exam. It's just made in the exam format so that you can kind of see a little bit like it's going to be when you take your Ncct test. So I do have a Google slideshow. Haven't done one in a little while, Miss Elise, have I? It's not been like that lately. But again, it's not going to be long. I have a copy of the test or the little packet that you'll be doing in lab today. So as I'm going through the slides with you, I'm going to be asking some questions that kind of correlate with that slide. Okay. So if you see me looking down, that's what I'm doing. I'm looking down, and you can slide 2. I've written which slide's going to go with each question. So does anybody have any questions before I get started with that? Okay, wet my whistle there for a second to get ready. Okay, so the first thing I want to talk about is not really lesson related, but it is class related. I'm reminding you that October is National Breast Cancer Awareness Month. So on Thursdays, we're wearing pink. It says Wednesday, but we don't do Zoom on Wednesday. We do Zoom on Thursday. So wear pink on our Thursday Zoom calls if you'd like, for just to show support. Also, we have our second little, I guess it looks like an invitation, right? This is join us in your best costume, Unitech online live lecture, and celebrate the fun at our Halloween costume contest. That's going to be October the 29th. It is a Friday, but it's going to be fun. And I would like for as many of you to participate as you want to. I will be participating. Best costume, that's instructor and student, wins a Walmart gift card. So I'll be saying this again Thursday to remind everybody. Okay, so the first key term that we're going to talk about is pre-authorization. So what is a pre-authorization? Or it's also called a prior authorization, and use either term, is the process of getting an agreement from the payer to cover specific services before the service is performed. When they are talking about a payer, they're talking about an insurance company. Normally, a payer that authorizes a service prior to an encounter assigns an authorization number that you will need to include on the claim when you submit it for payment. And I'm going to show you where that number goes. I'm just going to read the bottom here. It says pre-authorization requirement means that the insurance company will not pay for the service unless the provider, a physician or hospital, gets permission to provide the service. So if your insurance company requires an authorization and you do not get it, guess what? They won't pay. So if you're an insurance clerk for a surgeon, you'll spend a lot of time getting prior authorizations for surgeries. So this is a CMS 1500 form, and it's blown up. And in this blue box, this is where you would put your prior authorization number. See, they have the 1, 2, 3, 4, 5, 6, 7, 8. Our authorization number is going to be given to you by your third-party payer, so you don't have to come up with that. But it belongs in box 23 of a CMS 1500 form. So if one day I said, what number block does your prior authorization go in a CMS 1500 form? You could say 23, but this is towards the bottom on the right if you were looking at a whole form. Oh, wait. See, y'all, I'm still on NyQuil, so y'all, it's not flowing as well as I would like it to. Okay, so for example, a sample question that you'll see. After a patient is seen for a follow-up, the physician orders additional diagnostic testing. Which of the following does the insurance and coding specialist need to obtain? Allowed amount, pre-authorization, advanced beneficiary notice, or a referral? We're going to need that pre-authorization, right? So where do we get a pre-authorization from? Third-party payer, right? Insurance company. I'm going to call and say, hey, this is so-and-so. I'm calling about member number XUP 3679, date of birth, name, and you tell them what you're going to do, and they're going to tell you if it's authorized to be done or not. Because sometimes insurances don't cover everything. Okay, so that's one question. The other one is, when submitting a request for a pre-authorization, the billing and coding specialist should, and I'm just going to give you the answer, submit codes for any scenario that may arise during the procedure. Now, if they're doing a procedure on your hand, you're not going to throw in stuff for your foot, right? But your physician, your doctor is going to give you those parameters. For example, if you're going in and he's going to open you up to biopsy something, but when he gets in there, it's more serious than he thought, and so he's going to take it out of there. He's going to plan for a contingency, his contingency plan. So what if we can't just take the mass off? We have to remove the pancreas. I don't know. I'm just liver, you know, whatever it is. So y'all know I'm terrible when I'm put on the spot to think of an example. Okay, so here's another one. Which of the following statements is true about pre-authorization? It guarantees payment by the payer for treatment of surgical services. It does not guarantee anything. It guarantees payment by the patient for treatment of surgical services. Again, the guarantee word is not a word you're wanting here. It only pertains to medical necessity and is not a guarantee of payment. That's your right answer. Make sense? Okay. Let me make sure there's no more slide 2s. Okay, now we're going to go back and we're going to continue slides. Can y'all think of another word that you can use for pre-auth besides pre-authorization or prior authorization? Well, come on, let me go to the next slide. Precertification. Now, those words are sometimes used interchangeably. So we're going to talk about, I'm just going to give you the definition. A precertification is the process of obtaining this word right here, eligibility. Now, when you get a pre-authorization, you already know they're eligible. Certification or authorization and collecting information from the health plan prior to inpatient admissions and selected ambulatory procedures and services is also known as pre-admission, certification, review, or it can be called a pre-cert. So let me see if I have a sample question for that one real quick. Well, I found one. Sorry, it took me a minute. Okay. So a patient is referred to a specialist by the primary care provider, the PCP. Precertification is required for this patient's specialty visit. Which of the following actions is required by the insurance and coding specialist to obtain authorization? Do you contact the patient's specialist? Who do we call to get authorizations and certifications for services? Come on, y'all. The third-party payer, the insurance. So it's not going to be we're not calling the patient's specialist, right? We're not going to have the patient submit a paper claim. Or do we contact the patient's insurance provider?
Yes.
That's the one. We contact the patient's. Okay. I have one that I accidentally missed. I'm going to give to y'all. Which of the following is likely to be a cause for delay in receiving prior approval for a procedure or service from the insurance company? Okay. The procedure submitted is not included on the policy. Now, remember, we're talking about a prior approval. So prior approval means before the surgery, right?
Before the surgery, right.
Okay. So the first one says, the procedure submitted is not included on the policy. The date of service is not far enough in the future, or the resident performing the procedure is not credentialed. We just talked about that sometimes insurance won't cover certain things. If you wanted to go get a facelift, guess what? You're not going to get approval for that. It's not covered.
Right.
Gastric bypass surgery is generally not covered. There are certain things that are not covered by the insurance, and everybody's policy is different. I had Blue Cross Blue Shield. My policy covered gastric sleeve surgery, but you can't find any more of them out there that do that.
No.
But since they've updated that policy and you can't get it done anymore, that was at my previous position, when I was a coder. But every policy pays differently. Even Blue Cross Blue Shield policies, what policy you pick depends on what it pays for. That makes sense?
Yeah, so it doesn't cover any cosmetic.
Not generally.
Or anything.
Not generally, but you can get a gastric bypass or gastric sleeve if you have a heavy enough diagnosis to carry or warrant that as not being cosmetic. It can be a life-changing or life-saving procedure. It's very hard, but you know, it goes along with some other things out there that are very difficult. Right. So, okay, so let's go back to our slides. I'm just making sure that I don't have anything else to do with this slide. Okay, so what is an HMO? This is the thing that I want you to remember about an HMO. With an HMO, a referral from a primary care physician is typically required before you go to any specialist or order medical equipment. So when you see the word referral and you have HMO in the answers, it's going to be HMO. And I'm going to give you some examples. Okay. All right, so here's the question. Under which of the following circumstances does a patient need a referral from their PCP? For a woman's well visit, if the insurance plan is a PPO, if the insurance plan is an HMO. What did we just say? If you
HMO.
hear referral and HMO is one of your choices, it's always going to be HMO. So remember, referral, HMO, referral, HMO. In an HMO, plan members are required to obtain a referral to a specialist from the PCP, attending physician, consulting physician, or rendering physician.
Attending physician.
Primary care.
Primary.
PCP.
Primary.
Yeah, primary care physician. Which of the following physicians typically requires a referral with an HMO or POS service? Okay, remember, it's for specialists, right? You have to have referrals to go to specialists from your PCP if you have an HMO. So which of these would be an example of someone what you would need a referral for? Primary care physician. Do you need a referral to go to your primary care physician?
No.
No. Anesthesiologist. Why would you just be going to an anesthesiologist? It doesn't make sense. The only way that you're going to go to an anesthesiologist is if you're going to the hospital to have a procedure. So that doesn't make sense. Cardiologist. Cardiologist is a specialty of the heart. So would we need a referral to go see a cardiologist from our PCP?
Yes.
Yes, we do. What about a pathologist?
No.
No. So that was just one of the choices on there. So I just wanted to throw it in there. Which of the following insurance types require a referral from a PCP in order to visit a specialist? POS, PPO, EPO, or an HMO?
HMO.
HMO, because it's a referral from your PCP.
Right.
Okay, guys, I didn't come up with these questions. These are example questions that's going to be on your certification exam. I know it's different ways of asking the same questions, but I'm trying to get you familiar with the verbiage and how it's going to be asked. Okay. A patient who has an HMO insurance policy goes to the urologist's office. Before the urologist will see the patient must have a what?
Referral.
A referral, because a urologist is a specialist. Remember, IST stands for specialist, or OGIST stands for specialist. So anytime you go see a specialist, you have to have a referral from your PCP.
Right. Okay.
The family physician wants to send the patient to an endocrinologist, for management of the patient's newly diagnosed disease. The insurance and coding specialist should submit a request to the insurance company for a consult, transfer, referral, or workup.
Referral.
It's a referral. He's gone to his family physician. He has just been diagnosed with diabetes, so he needs to go see a specialist.
Right.
When you have a consult is whenever you're just going to go, like in the hospital, it's usually a consult. If you're in the hospital, you have to have a consultation. But this is a referral. They're actually sending him from one office to another office. So that's a referral. Double check it. Okay. I know you are tired of hearing this HMO. I am going over it because why? It's so important. Which of the following information can be required for an HMO that may be unnecessary for a PPO when submitting a CMS claim form? Patient's birthday, insurance name, referring physician, diagnostic pointers. What goes with an HMO?
Refer physician.
Referring physician. So you understand how that word referring keeps showing up over and over again?
Right.
That's why I said when we looked at the slide, referring, PCP, HMO, they go together. All right, so let's go back. So what is a copay? A copay is a fixed amount. For example, it can be $20. You pay for a covered healthcare service after you've paid your deductible. Let's say your health insurance plan allowable costs for the doctor's visit is $100. Your copay for a doctor's visit is $20. A copay is a flat fee that you pay when you receive specific healthcare services, such as a doctor's visit or getting your prescription drugs. Your copay is also called your copayment, will vary depending on the service you receive and your health insurance plan, but copays are typically $30 or less. Copays are a form of cost sharing. Insurance companies use them as a way for customers to split the cost of paying for healthcare. Copays for a particular insurance plan are set by the insurer. Regardless of what your doctor charges for a visit, your copay won't change. Okay, so when should you, I'm gonna back up. Remember we talk about real world versus book learned stuff? When you come across this question, and you're going to in your Ncct prep and your test, when is the best time to get payment, your copayment from a patient? When do you usually pay?
Once you go to your doctor visit.
Right, but do you pay on the way in or do you pay on the way out?
Usually you pay on the way out.
I always pay on the way out, but in this particular question, you're going to take the payment before the patient is seen. Do we do that here? No.
No.
I've never paid for an appointment before the appointment, ever. But I can't help what the question says. I didn't write it. I just want to tell you, it's backwards on this test. They're telling you to get the payment before you see the patient. If your facility requires that, then that's what you do. But if they do not, you accept it after. I just want you to know that one of the options is to pay on the way out. That is going to be marked wrong. It has to be before you see the doctor is what it's going to say. All right, so let me see if I have any more questions on that one. Okay. Which of the following should always be collected from the patient at the end of service? At the time of service, coinsurance, deductible, maximum out-of-pocket, or the copay?
What was the question again?
Which of the following should always be collected from the patient at the time of service? You're going to the doctor. He's giving you're at your time of service. It's going to be copay.
Copay, right.
It's going to be copay. So I have a $40 copay. I wish mine was 20. And then I pay about $32 a month for my prescriptions.
Right.
Those are my copays. Okay, so let's go back. We're almost done, guys. I know this is not the most exciting, but it's so very important. Okay, so what is workers' comp? Workman's comp. Workers' compensation insurance, commonly referred to as workers' comp or work comp, is a state. I need you to remember this, is a state mandated program that provides compensation to employees who suffer work-related injury or illness while on the job by providing monetary awards to injured employees covered under workers' compensation. Employers can lessen or hopefully eliminate risks of litigation by the injured employee. Specific workers' comp guidelines vary state to state, but there are some general principles that can generally be applied across the board. So did y'all hear me keep saying state, 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 state? It's a reason. Workers' compensation policy guidelines are determined by the federal government, the state government, OSHA, or the employee's human resources department.
The state government.
The state government, because it varies from state to state to state. So it's the state government. What are some things important to know if you need to fill out a workman's comp claim? Date of the injury. The date of the injury. There's lots of things to know, but I'm just pulling out some things that, you know, I can think of. The place of employment and their mailing address. Patient's name and date of birth. But the biggest thing, you have to have that date of injury. You have to have the date of injury. Because if they're like, oh, well, it happened maybe last week, so can't get a workman's comp claim on sometime last week, there has to be an exact date. Okay, so the last one that I'm going to ask you, let me find it before I let you go, is when a patient fills out an intake form upon registration, coming into the office, giving them forms. Which of the following vital information is needed on the form in order for the provider to get proper reimbursement for services? So we're looking.
Insurance information.
What do you need? Yes, you get insurance information, but Miss Elise, how do we obtain that insurance information?
From the.
We're going to take a going to take a copy of their insurance card.
Okay.
Do we just take a copy of the front?
No.
Take a copy of
That's
the front and the back. Why do we want the copy on? Why do we need it from the back? That's where our phone numbers are. Our phone numbers are back there. So if you need to call, and you can read on the back of a lot of cards, it's for claim information, call whatever number. For this, call this number. So, all right, guys. Well, that is it. I think you're going to be ready to take this little NCCT prep exam. This is only, I think, let me see how many questions. I only gave y'all 20 questions. Guess how many questions are actually in the packet? 89.
Wow.
So I'm going small. I would rather go small and you really, really know it, because the next time we talk about an HMO, what are you gonna listen for? Referral, primary care physician. So no matter what a PPO is, it doesn't matter if it says referral and primary care physician, you're gonna know that's my HMO right there. That's my HMO. Okay. Prior authorization, pre-authorization, pre-certification. We're going to continue to work on questions with those, because those words, even though they're used so interchangeably, and so we need to make sure that we understand the difference they're looking for on the exam, because in a doctor's office, we use pre-cert and pre-auth as the same thing. Right. So we need to make sure that we're able to look at the questions and make sure that we know what we're looking at. Okay. I haven't found a question yet that uses pre-cert and pre-auth in the same choices. It's either pre-auth or pre-cert. So I think that's why, because it's used so interchangeably. But this is so important that we get through this packet and you feel comfortable. All right, guys. Well, that's all for today. I hope you See, I'm on NyQuil, guys. I hope you learned something. And again, we're going to keep going over this. You have this very same little template that I read off of. That's your lab today. So you're going to feel good about going in and doing that. Start making a list of key terms that you need to remember. You can put HMO equals referral and PCP. I mean, it's just those quick little things that are going to come to your mind. You're going to feel comfortable. So have a wonderful day. If you need anything, let me know.
Thank you.
Bye, guys.
Bye-bye.